Welcome to Verb Voice, featuring interviews with leaders in the clinical research ecosystem. I'm your host, Rob Howie. My guest is Ken Getz, Executive Director of the Tufts Center for the Study of Drug Development and a professor at the Tufts University School of Medicine. Ken, as always, good to see you again.
Thank you, Rob. So good to be here. Thanks for the invitation.
CRA Assessments completed an industry study on the relationship between CRA experience and performance. What are your reactions to the results of that survey?
Well, my initial reaction, Rob, is one that I have often when I see the results of surveys like this, and that is that drawing the insight that years of experience is not predictive of CRA performance is affirming what we've intuitively known for a very long time. And we see so many surveys like that, where we can look at perhaps a variable, a condition that we use as the basis to predict performance or to drive our expectations and plans, when in fact, there's much more going on here. And that's clearly the case. We know there's so much more at play that really relates to the training that an individual has received, a sort of personal work style, their mentorship experience, the coaching that they received, their exposure and familiarity with real life experience. There's just so much more here, and that experience alone is just not an adequate variable for us to rely on.
Ken, the clinical research industry is clearly aware of the shortage of CRAs, a challenge that appears to be getting worse. What will it take for the industry to solve this challenge by adopting perhaps a more innovative approach to sourcing and training and deploying CRAs?
Yeah, and let me start with an answer, Rob, that this is probably one of the largest and most pressing challenges that we face as an enterprise right now. Our workforce shortages, the talent shortages, and most notably among the CRA community, one of our most critical oversight mechanisms that we have in place. So this is such an important area. It's also, of course, a complex problem, as you know so well. And there's a lot going into creating this, the shortage that is related to retention challenges, burnout, turnover, the failure to really create a career path that will be sustainable for this workforce. It's just much more transient than given the unique workload. And then on the recruitment side, you can point to so many places where we've really targeted a very narrow defined pool of talent, when in fact we need to cast a much broader net and really look to other life sciences and allied health areas to attract candidates as well. And the innovation comes in part in how we more effectively recruit and retain. My sense is that what is also at play here, however, is really the ability to just expand our thinking and to view the CRA position not in isolation, but in fact as a progression, and it represents a stepping stone for professionals who are sort of entering our enterprise and then want to stay here.
The CRA role is evolving, driven in part by decentralized trials and an even greater focus on data and new technology adoption. How do you see the CRA role changing in the years ahead?
Yeah, a lot of it will be a continuation of what you just said. From where we sit at the Tufts Center, and we've monitored the CRA landscape for some time, and we've noted for over a decade that workload continues to rise at a faster rate within this community than elsewhere. As you noted, for example, the typical CRA is now covering more sites on average than we used to see, not to mention the responsibilities that all go into that coverage and that management of each site. The volume of data that's being collected increasingly in virtual and remote operating environments, which really demands a totally different set of skills in many cases. So a lot of what you describe really points to ways that the role has to evolve, where the CRA plays an even more active role as a data analyst and a data manager, where they can be much more effective while working in a more remote or virtual environment. So the communication skills are even more critical. And one other place that we're seeing is the ability to perform in a more agile manner. That's really hard to articulate clearly, but the ability to nimbly adjust and change and pivot almost at a moment's notice is one place where the CRA has to become particularly adept.
Ken, I want to change gears for just a minute and ask you a question about diversity. The Tufts Center for the Study of Drug Development has studied the need for greater subject diversity in clinical trials. What impact does a more diverse clinical workforce have on achieving that goal?
Our research, and this has been corroborated with many other studies in the literature, is just showing at every level that a more diverse workforce really contributes to richer insights and far more successful performance and innovation. We've seen that time and time again. One particular study that we published recently, and this may be one, Rob, that you're getting at as well, which was just so apparent and profound in its relatively simple message that the diversity of the personnel at the investigative site is predictive of the diversity of patients enrolled in those studies. And we have comparable work that we've done looking at a diverse workforce within sponsor and CRO companies as well. The better we reflect all of the communities that we serve, the better will be our performance ultimately.
Our guest is Ken Getz of the Tufts Center for the Study of Drug Development. Ken, thank you for sharing your perspectives with us.
My pleasure. Thanks so much.